All right. Okay, so we're continuing talking about what is bioethics. Some introductory comments. Hello, Mr. Saravo. Saravo. Yes. And let me get on the PowerPoint here. We ended with sickness. I believe the definition of sickness. Whoops. Go back. There we go. Sickness. The condition of being disordered, weakened, or unsound in body, mind, or spirit. And you can see where the word comes from in Old English, seok, which basically means the same thing. You are unwell, you are diseased, you're corrupt or weak. But it also has the sense of sad or troubled. So it kind of has that dual meaning of both the bodily issue of being unwell or being diseased, but also that, say, spiritual issue of being sad or troubled, having bad feelings, or being disturbed in spirit. But we don't just speak of sickness, we also speak of it as illness. And what is the distinction? Is there a distinction? Are they the same thing? Aren't sickness and illness the same? Not necessarily. Not necessarily. Illness would be, whoops, I'm going to the wrong computer here. Illness, to be ill, is to be unhealthy, to be unwhole. So there is a distinction to be made. Sickness is focused on the condition, God bless you, of your body, mind, and spirit, which is disordered. Okay, there's something wrong that needs to be cured. But ill means you are unhealthy in body, mind, and spirit. It's not exactly the same thing. And the fact that it's not exactly the same, well, let me first go over. It comes from the Old Norse word iller. Old Norse, if you're just curious, if you get Norway, the country of Norway, their ancient Norwegian language is called Old Norse. In case you're wondering, it was the language of the Vikings. And the word literally means something that is evil. It's bad for you, okay? And we kind of use it in that sense still in English. We can say someone is ill, and you get this. You have the idea that, oh, the person is sick. But if I say I wish you ill, I don't necessarily wish. You don't have the sense of I'm wishing you to be sick. I'm wishing for some evil to befall you. I'm wishing for something bad to happen to you. I wish you ill. Okay, so that again, that meaning of evilness or badness comes into play even still in modern English. We still have that kind of, again, that twofold meaning to the word ill, even though in our context, and generally, people mean you're unhealthy, you are sick. Okay, they're synonymous, but there is a minor distinction. The word can also mean something that's hard or difficult to do. So illness, from the perspective of the way the word comes to us as something that's evil or bad, is a moral evil, in the sense of being ill, in the ancient sense of being ill. It's not, in other words, it's not something that's good or desirable for the human person. Illness harms and destroys the human person. Hence, illness is evil. It's an evil. It's something that is wicked, that is not good for the human person. And we kind of recognize this with sickness and illness. We recognize that this is not a situation that is good for the person. Who cures sickness and illness? Who has this art of healing? Well, that would be, come on, whoops. Oh, I forgot about my little picture of the little sick boy. Okay, yeah, see, he's not happy. So, I mean, you look at that, and you can think, he looks sick. You know, and you know when people are sick, because you can say, well, you look sick. You know, your eyes are puffy, your nose is running. Ooh, she's speeding along there. Watch out. Wouldn't want to get in her way. Anyways, you know, your nose is runny. You don't look, even if you cannot personally feel what the person is feeling. You can say, you don't look good. Something, notice how you even say it. You don't look good or well. The person who has the art of healing, who brings you to wellness or to wholeness, is the physician. A physician. Or you can say a doctor, but doctor is a very general term. I'm a doctor, but I can't treat anybody, although I do have some fun with it when I do go to the hospital. I have just some fun with the nurses, because my mom went into the hospital one time and she said, "Oh yes, my son's a doctor." She was so proud, and the nurse was trying to feel me out. She's like asking me some technical questions. I said, "Nah, don't ask me that. I went to a Caribbean medical school." It's like, I want to know the answer to that. And then she went in for surgery, and the nurses and the surgeons were all hepped up. "Oh, your son's a doctor too." Well, he's a theologian. Like, oh, well, they weren't so excited after that. So I would preferably use the word physician rather than doctor, because doctor is such a general term. The reason they're called doctors is because they have medicine doctor, MD. They have a doctorate in medicine. That's what you get in medical school. Whoops. I wonder why they left it here when it's all pooped out. Okay. I'll let that garbage in here. Let's see, in the back. All right. Thank you, Miss. Okay, that's literally what it means, a doctor of medicine. But I'm not going to use that for the most part. I'll try to stick with physician because it's more specific, and a person who is trained in the art of healing. It's that simple. It's not, medicine is the art of healing. And in fact, the word physician, as you can see from the etymology, comes from Anglo-French, which means literally physician. Physician. Medicine. Physique. Medicine. All right. So a physician is one who practices medicine, which is the art of healing. If you're wondering about what Anglo-French is, it just means that at one time in England, they spoke French because the French invaded from France and they took over the English monarchy. In fact, to the present day, the slogan of the English monarchy is a French phrase. So anyway, a lot of French words and terminology poured into the English language. So that's helpful to us because a lot of these terms that we're talking about, even in healthcare, that come from Latin roots and stuff like that, French is a Latin-based language, so it helps us to understand the words. We already have them sometimes in English, either via Latin itself, just directly, or via French from Anglo-French, from when the Normans, they were called, the Norman French from northern France invaded England and conquered them for a period of years. Eventually, the English kicked them out. So a physician. We have Ms. Let's see. Well, I only have, one choice. No, I have two choices. Ms. Weir?
Yes.
Okay. I forgot that this shirt does not have a pocket. Okay, so we're just waiting on Ms. Reyes. Let's see if she comes. We talked about health, and we've talked about those who bring health to us, physicians, but the phrase is health care. What do we mean when we talk about care? What is care? Well, care is a state, believe it or not, is a state of uncertainty, fearfulness, and responsibility, which doesn't seem to make sense when, in the normal sense of what you think with health care. But if you think about it, it does actually work. The word care comes from Middle English, which means sorrow, distress, concern. Okay? Again, you can see these spiritual issues coming up of sorrow, sadness, but also concern. And our old friend Old Norse comes up again because the word care, ultimately the word in this ancient language of Norway means sick bed, the sick bed. So here you have a direct connection between the word care through English, through Old Norse, to again this concept of sickness and illness. Now, what do uncertainty, fearfulness, and responsibility have to do with health care? I mean, it sounds like we're talking here about anxiety, but it can mean watchful attention, watchful attentiveness, and especially in the case of health, well-being, and safety. And you do see this in hospitals. I mean, certainly the physicians care for the patients, but most of the actual work is going to be done by nurses. And certainly the healthcare professionals are in states of uncertainty, fearfulness, and responsibility. They don't necessarily know what's wrong with the patient. They don't always know what to do for the patient. They're doing things which they hope will treat the patient, but there is uncertainty at times. There's also fearfulness. You're fearful for your patient. That's why you keep an eye on them. Why do doctors make rounds? They have to go around and see all their patients every day to see that the patient is doing well or that the treatment is working. I mean, there's an element of fear there, not being scared, but watchful over the patient. The same thing with nurses. Nurses have to check in on the patients. They're fearful. They're watchful. They want to make sure that the patient is doing well, or that the patient hasn't coded on. The patient died in the midst of their lunch break or something. And then responsibility. I think responsibility is the easiest one to connect to care because you are responsible for the people under your charge. You are caring for them. You are being responsible for them. They can't take care of themselves. Okay? They might be uncertain. The patient might be uncertain, fearful, but they might be irresponsible in the sense that they can't give themselves the medication. They don't know what medications to take. They don't know what tests to run or how to do the tests. So you are responsible for them. So they are in your care. The person who's in your care, you are acting on them, and they are allowing you to act on them. Okay, you are the agent who is acting on them. Keep going for the wrong mouse. Okay. Oh, wait, before I go on to that, there's a reason why I got this picture from Samuel Luke Fildes. I'm presuming it's pronounced Fildes, 1891, so it's in the public domain, so I'm using it appropriately. And I just thought it was, speaking of appropriateness, it was an appropriate illustration in pictorial form, an artistic form of care, because the doctor is the man seated, okay, and he's caring for what I'm assuming is a little girl, but you don't know, but it's obviously a child. I'm assuming a child. And he's caring for this child, and what I find, it kind of brings together these ideas of uncertainty, fearfulness, and responsibility. Okay? There's another person standing over here, which I would assume is the father. But he's not, he's standing over here. He's behind a couple of chairs that they have the girl on, or I should say the child. I shouldn't assume that it's a girl. But they have the child on these chairs, not even in a bed, just so it seems like it's serious, something serious. They don't even have in a proper bed. They just took some chairs and put a pillow on it and threw the kid on it. Okay? And here's this man, and whoops, I didn't want to do that. Move it around. All right, now how do I get it to go back again? Let's see here. Go on here and get it to go back.
There is a zoom out button right there in the bottom left corner.
Okay, thank you, sir. Just seeing it on my computer, because I don't have it on my computer, but it's on here.
Yeah. See the bottom left in the middle.
There we go. You're pressing it, nothing's happening. Let's make it bigger. But hold on. All right, so that's as small as it's going to go. I thought this interactive aspect would be kind of cool, but if I turn this off, does it do anything? All right, well, anyways, you can still see the picture. It's just bigger. Now look how he's hunched over. The physician is hunched over. He's looking at the child. Who knows if he gave the child? I mean, there's a cup here. I don't know if it's for the doctor, the physician to drink from, or if he gave the child some kind of medication in the cup. And he's waiting. He's pondering. What's the problem here? He's concerned. Care. Concern. All right? He's fearful. If you look, you can kind of see it on the face of the person in the back here, which I'm assuming is the father, or certainly a male relative. Look at the face. Look how the artist has decided to draw the face. His eyes are wide open, and he's staring not at the child, but at the doctor, at the physician, at the man who should know what to do, should know what to do. Hopefully does know what to do, but maybe doesn't know what to do. So there's kind of a threatening aspect of it here, and this is not unusual. I mean, in the ancient world, it was dangerous to be a physician, because if your remedies didn't work, well, you had to get out of town rather quickly, because people might not be happy if the remedies you gave didn't work for the person and the person died. So it could be dangerous to be a physician. People blame you. Okay. So care. I thought this picture embodied the impressions of the definition if they weren't clear enough. And now I've got to get the picture off of. Oh, hold on a second. Ready? Let's see if I go back. There we go. Picture back. Okay, a patient. You allow the doctor or the nurse, the physician or the nurse to work on you, and that makes you a patient. What does that mean? Well, they are the agent. They're the ones who are doing. The word agent comes from Latin ago, to do something. To do, ago. So the physician or the nurse is the agent. They're the ones who are doing. You are the patient. You're someone or something that is acted upon. And you can see where it comes from. It comes from the Latin word which means to bear or support something, but also to undergo something, to suffer it, to endure it. The patient is a sufferer. You are undergoing something, usually pain if you're suffering. But that's oftentimes what's going on with a patient. Not always, because you can have patients who come in just to have tests run. They're not necessarily in pain or suffering, but, it might be, the time for a colonoscopy, all right? Or it might be the time for a breast exam. And the person's not necessarily suffering or undergoing anything, but they are enduring testing. So they are a patient in that sense. They are being acted upon. The physician is the agent, and the sick person is the patient who receives the care. So, what is bioethics? After all of this long talking about bioethics and various terms used in bioethics, so we kind of get our terms straight and we know what we're talking about, what actually is bioethics? How would I define bioethics? Well, bioethics is a subfield of ethics. Remember, I said applied ethics. Remember, applied ethics, that it's not a theory per se, although theory is a major part of bioethics, but you are applying it to situations. So it's called applied ethics, okay, which is a subfield of ethics. And it concerns ethical issues arising from medicine and advances in the biological sciences. So a lot of bioethics deals with medical issues, but it also deals with biological issues like cloning or whatchamacallit, what's the word? Well, it's things like cloning, manipulating the genome, stuff like that. Areas of concern for bioethics include ethical issues between healthcare professionals and patients. Should you lie to your patient? Or another way of putting that is, should you tell the whole truth to your patient? If your patient has a diagnosis of cancer, a serious diagnosis of cancer, deadly diagnosis, should you tell her? Maybe she can't handle it. Should the patient know? Should the patient know test results? You take blood from the patient and run results, and it comes back that the patient has HIV or AIDS. Well, does the patient have the right to know those results? I mean, those are for you, the healthcare professional, to know, and it will guide your treatment, and you will treat the patient. But maybe the patient, that's going to ruin his or her life. Yes, sir.
So could you treat someone without telling them their diagnosis, or
Physicians have.
and it was legal, or because I don't think that's not moral in that.
Well, the question, I don't know the legality of it. I'm not a lawyer, so I don't know if someone could sue a physician for not telling him or her what the diagnosis was.
But giving the correct treatment for that, even though they don't know,
Yeah,
that's still pretty okay.
that should be okay. I mean, would you consider that ethical for the physician to do? Not tell the patient what the diagnosis, not fully tell the patient. Maybe tell them you have an issue that needs to be treated, but maybe to not tell them, but you still treat the issue.
Mm-hmm.
You think that's ethical?
No.
Okay, why not?
Because if they know what the treatment is, I guess it is, but if they don't know what actually is wrong with them, and there could be other ways of helping it, I don't think that.
Okay. What about medical mistakes? What if you're in surgery and you nick an artery? I mean, you repair the artery and everything's fine, but do you tell the patient that there was that issue during his or her surgery? Is that ethical?
Yeah, so,
You have to? Depends on who knows.
I mean, yeah, I guess.
I mean, the patient doesn't know. The patient is under anesthesia. The patient doesn't know unless the patient dies. But what if it's a near miss? If it's certainly an adverse effect where the patient dies, you dig the artery severely enough that the person bleeds out on the operating table. Well, you've got a corpse to happen. You know what I'm saying? So you have to tell the truth, kind of. Maybe you come up with an explanation of how it happened, which isn't the full truth. But what if it's a near miss? You dig the artery and it bleeds a little bit, but you are able to repair it quickly enough that the person doesn't bleed out. The artery will heal on its own, obviously. It's a near miss. Is it ethical to tell them that?
Yeah.
Or not tell them?
I think it depends on how big it is, but normally I feel like you should ethically.
Always?
Yeah.
Always. Even for near misses, little things that happen. Okay. So we're dealing with the first issue of how healthcare or healing professionals are dealing with their patients. How do you treat the patient? Ms. Reyes. Yes, good morning. Okay, so everybody's here. So that's probably, I guess, this first issue is the most obvious issue of how you treat and handle your patients. Is it ethical for me to withhold information from my patient? Is it ethical for me as a physician to do things to my patient without the consent of the patient? Okay. sterilizing a disabled person has been done, and has been done actually with the approval of the U.S. Supreme Court way back when. So these are issues that bioethics will address, will talk about. Other issues include social justice in healthcare. Social justice, what does that mean? It means who gets healthcare, how much healthcare do they get? Is it ethical for people who have the money to get healthcare? It would seem so, but what about people who don't have money? How, should they get healthcare, and how much healthcare should they get? Because healthcare is expensive. Ultimately, someone is going to pay for it. And if it's a situation where you have a very severely poor person who just simply can't pay for an operation is going to run about $100,000. Social justice. Well, what do you do with that person? Do you still operate? Or do you find some other way to treat the person? Whereas someone who can pay the $100,000 out of justice, would they then get the treatment? They should get the treatment, would you assume? So ethical issues like that. I mean, those are questions that have to be addressed, especially when you're talking about healthcare in this country. I mean, we don't have universal healthcare, but this was a debate that was going on years ago under former President Obama, many, many years ago. Long time, it seems like maybe a long time ago now, which has not been fully resolved in this country because we basically deal with the issue of, you have to pay, you have to be able to pay. So you need insurance. The insurance will pay, and the insurance will kind of decide what kind of treatment you need. In, of course, talking with your doctor. But you have countries like, for example, Great Britain, where they have universal health care, and basically the system is, I'm simplifying, but the system is that all the money is thrown into like a big pot. And once the money is all gone, the budget is depleted for the year, or almost depleted. You can't treat people anymore. You have to start making those decisions, those ethical decisions about people who can't pay for their health care, but have maybe some rare or semi-rare disease that needs treatment. Sometimes you have to let them die. Just no money. And do people, does this make the news? Yes, it makes the news, especially if it's a child who's dying. It makes the news all the time in Great Britain because that's just the way their system works, and they have to make these social justice ethical decisions. And thirdly, new biological knowledge or technology. Okay, 40 years ago, 50 years ago, we knew about genes, but we didn't know necessarily everything about how they work. And we certainly didn't have the genome mapped, so we didn't know what genes did what. And we certainly didn't have the technology to manipulate them. So turn genes on and off, in a manner of speaking. So you could, if you could find the cancer gene in a person, they can't, I'm just saying for hypothetical purposes, you could possibly turn it off, okay? Or if you could find the gene which causes mental disability, you could turn it off so that the person's baby, you could go in and intervene so that a person's baby wouldn't be born with Down syndrome or attention deficit disorder or whatever the mental illness might be or mental disability might be. Are these ethical things to do? Okay. Are there times when you can do them? Are there times when you can't do them? So these are questions in bioethics that are addressed. So it's not just medical stuff. There are other things that are going on as well. Bioethics is used generically there are three sub-disciplines to bioethics. Medical ethics is the main one, and as I said, is the main focus of this course. It's mostly, if you look in the literature, if you go out looking for examples of bioethical problems, most of the time you're going to come up with medical case studies. Okay, so I put it first, and that's why most of the focus or my examples will come from medicine and stuff like that. But it's not the only thing that bioethicists talk about. Remember, it's bios, it's living, which really the Greek word bios, as I told you, applies to human living and human flourishing, a human life. Zoe is properly the Greek word for all animal life. God bless you. Which includes humans because we are animals. We're descended from animals. But more specifically, it's dealing with animals, lions and bears and whales and birds and stuff like that. That's what Zoe is in Greek. That's the distinction. So we wouldn't really talk about that for medical ethics necessarily, but because it is bios, again, they're using this in the sense of also Zoe, it can include animals. How do we treat animals? So animal testing, the ethics of animal testing would be a question that would come up in animal ethics. And some people extend bios not just to include the Zoe, which would be animals, but to include the cosmos, Greek cosmos, which would be everything. Cosmos in Greek just means the universe, the universal world, so everything. So not just us, medical ethics, not just animals, but also the cosmos, everything. So also called environmental ethics, the environment. Okay. So everything out there we can see. We see a tree, we see grass, we see bushes, we see the atmosphere, the sun. Although I don't think we can do much ethically wrong to the sun. I think the sun can do a lot that's ethically wrong to us. A few cancer cells between friends. So I'm just saying, the sun's a great thing to have, but don't stay out too long in it. So environment, it also includes environmental ethics, how we treat the world, pollution, climate change. Those would also come under the umbrella term of bioethics. So just so you know, all right, these three subdisciplines of the field. Again, I'm going to be focusing mainly on medical ethics. I might mention some things in regards to animals and the environment, but mostly I'm going to be focusing on the human aspect, which I take to be medical ethics. Okay, so even though there is a particular focus with each, medical ethics is primarily human-centered, animal ethics animal-centered, environment is the world, the physical world-centered. There is significant overlap on issues, on approaches, the approaches that people use, concepts and moral considerations. What all of these subdisciplines assume, they presuppose some knowledge of the life, what we call the life sciences. So medicine, biology, chemistry, physics to some extent. I know if you're going to be pre-med, you have to take physics, etc. Okay, so even though a bioethicist might be talking about the ethics of climate change and how we're treating the world, the person is going to be using meteorology. They're going to be using the meteorological sciences of weather. They're going to be using biological sciences of how pollution affects the earth or affects living beings. So the life sciences come into play. Whoop. Why are they doing that? Let's go to the next slide, please. There we go. According to John Stewart Gordon in his article for the Internet Encyclopedia of Philosophy, this article on bioethics. Anyone want to read that? Does anyone want to read this quote from John Stewart Gordon? Mr. Dietzel.
Bioethics is concerned with a specific area of human conduct concerning the animate. You want to read the parentheses too?
Yeah.
Animate, for example, human beings and animals, and inanimate, for example, stones. Natural world against the background of the life sciences and deals with the various problems that arise from this complex. Amalgam.
Amalgam, good sir. Yeah, amalgam is like it's a fancy word for a combination. So if you bake stuff, and you throw in some flour, you throw in some eggs, you throw in some sugar, and you mix it all together, it's kind of like an amalgam. It's a combination of stuff that you put together. So bioethics is concerned with human conduct in regards to animate and inanimate objects, inanimate things. What is animate? Animate simply comes from the Latin word soul, anima, or you could say a life principle. Literally, it's soul, but in the sense of a life principle. what makes you breathe, basically. That thing that makes you breathe and gives you life. So bioethics, what's a definition? My definition of bioethics, the definition I'm going to give to you is this. The system of study of the ethical and moral questions that can arise from the practice of the life sciences and health care. Okay, studying the ethical questions, what to do in the areas of life science. So that covers like genetic manipulation, questions of genetic issues. But it also can cover things like in vitro fertilization, using techniques and technologies to create life outside of a woman's uterus and like a test tube baby, as it's called. But also healthcare, all the issues that come up with caring for someone, trying to bring them to wholeness, questions of treating suffering, but also a lot of these questions deal with dying, either actively, directly or indirectly causing dying, killing, say abortion, but also letting people die, end-of-life issues, like, say, questions of euthanasia or how much treatment you should give a person who's at the end of life, how much treatment is reasonable or proportionate to the benefit that it's going to give or not proportionate. Sometimes things you can treat the person, but it's not going to work because the body's dying. And there's just nothing you can do. It's like a sinking ship. You have to give palliative care in that. You have to kind of transition to making the person as comfortable as possible. So those questions of healthcare. So that's my definition for you of bioethics. Now, moving on. My other PowerPoint. Oh, and I sent out a third PowerPoint on principles of bioethics to you, so you can print that out. And I really do recommend it. I mean, it saves you time if you can print out. Is it easier if I send it as a PowerPoint slide presentation or a PDF? Is it easy? Which is easier for you to print out? Either one? Doesn't matter? Huh?
Either one's fine.
Either one's fine. And do you have access to printers? I know I've been told there are limitations on how much students can print out, I think. I don't know if that's true or not because I'm not a student, and obviously. I mean, I am a student in general, a student of life, but I'm not. Okay, but you can print things out. Okay. So I would recommend that. It saves you a lot of time and you can write your notes right on the PowerPoint. That's why I give them out to people. So the next PowerPoint we're going to look at, or the next section we're going to go into, is a history of bioethics. A very brief history. So let me emphasize the very, although the PowerPoint slide is rather longish. It's longer than I wanted it to be. I might cut some stuff out. Introduction. Bioethics as a field, as a discipline, is rather young. And again, this comes from our friend John Stewart Gordon in his article, Bioethics in the Internet Encyclopedia of Philosophy. It's, quote, a rather young academic interdisciplinary field. By saying that it's interdisciplinary, again, it means that bioethics uses or takes from a number of different disciplines, not just one thing. It's not just philosophy. And talks about philosophy, but it talks about medicine and biology, sociology, anthropology. So these are different disciplines, and bioethics will draw on them. The notion of bioethics and the origin of the discipline itself, it's what you could call its institutionalization. I mean, the fact that we're teaching it here at an institution, an academic institution, has institutionalized the field, okay? It's now kind of it's got credibility. People are talking about it. People are teaching it. People are thinking about it. But it's the notion of bioethics and its origin as a discipline in academia is a modern development. How modern? Well, we could say the second half of the 20th century. So since the 1950s, you had a revival in the 1950s of our other friend, applied ethics. And as that happened, people started talking about medical issues. So we could say roughly around the second half of the 20th century. So beginning around the 1950s, we have the seeds, we have the germ of, let me move this over here so I'm actually in frame with the video. The germ of bioethics, although it comes out of this revival of applied ethics. But nevertheless, bioethics could be seen as going back as far as the Code of Hammurabi, which is an ancient law code from the 1700s BC, which we'll talk about, which contains prescriptions about medical practice. As a phenomenon, bioethics can be traced far back to the Hippocratic Oath, which some of you might be familiar with if you're in the medical sciences or healthcare sciences. You know that there is, I don't think nurses take it, but physicians will take it once they graduate or sometime before they graduate medical school. They'll take the Hippocratic Oath or a modern version of it. There are various versions of it now. They might not take the ancient original Hippocratic Oath. But this idea of a physician taking an oath can show that the phenomenon of medical ethics or bioethics goes back even farther, and that would be around the 500s BC. The idea of the status of animals and protecting the environment are more contemporary concerns in bioethical movements. So when we looked at those three subdisciplines of medical ethics, animal ethics, and environmental ethics, medical ethics is really where bioethics starts, kind of cuts its teeth on medical issues. And it's only in very modern times that concerns about animals and concerns about the environment have come into play and have come under bioethics. Where does the word come from? Well, the word comes from this man Fritz Jahr. Before I talk about Fritz Jahr, the idea was already there. As I told you before, a lot of times bioethics is called medical ethics, it's called health care ethics, it's called biomedical ethics. And the reason for that is because it comes out of what people saw as the need to address ethical issues in medicine. And so the terminology of medical ethics goes all the way back to 1803 with this gentleman called Thomas Percival. He's the first to start talking about this field, this discipline of medical ethics, where you study the ethical issues involved in medicine, the delivery of medicine. He's the first one to mention it. And the field was mainly conducted by philosophers, theologians, people who study God, so religious, you might say religious philosophers, okay, and physicians, people who were healing practitioners who had ethical issues and they wanted to think about them in a systematic way. The word bioethics comes from this gentleman, Fritz Jahr, as I just told you a moment ago. You can see what his dates are there, 1895 to 1953, who is a German theologian. Okay, so I just mentioned theology. Theology is the study of God. Okay, so it's a faith-based philosophy, you could say. That's its focus. It assumes a belief in a certain revelation. You have Christian theology, you have Jewish theology, you have Islamic theology. They're assuming their beliefs, various beliefs in God or the supernatural. So Fritz Jahr was a German theologian, and he published an article in 1927 which uses the word. So here we have the first use of the actual word, bioethic, or bioethics. Bioethics, a review of the ethical relationships of humans to animals and plants. You can see even from the title of the article, he was kind of forward-thinking in the sense of already seeing those subdisciplines of animals and the environment. And in his article, 1927, but he also published an article in 1928 and another article in 1934, arguing for this new discipline, this new academic discipline called bioethics, which would contain a new ethical approach to issues of the human and the environment, and how these things, how humanity should be related to animals and the environment. And he argued for what he called a bioethical imperative. Quote, respect, this is a quote from, I guess, the first article, but nevertheless from Fritz Jahr about what he meant by a bioethical imperative. Respect every living being in principle as an end in itself, and treat it accordingly wherever it is possible. So, for example, in the case of animals, you would not treat an animal as a means to an end. You would treat the animal as an end, as a thing deserving life and respect in and of itself, okay? As you would with, say, a human person. So that's where the word comes from. But the idea of bioethics, this idea of an ethical viewpoint about how human life should be treated, especially medically, goes back much farther. And I already mentioned the Code of Hammurabi, so we're going to look at the Code of Hammurabi briefly, because it is our oldest example that we have of someone, in this case, the ruler Hammurabi, looking ethically, kind of ethically. We'll see it's not completely an ethic in a way, but looking kind of ethically at medical practice or how human beings should be treated in the context of healthcare. The Code of Hammurabi is a legal text. It's a series of laws, and it was composed, as you can see, the dates there, 1755 to 1750 BC, before Christ, or you could say BCE. A lot of times you'll say BCE, which means before the Common Era, before the Christian era, but it's the same dating system. There is no such thing as a Common Era. It's a made-up thing because sometimes people want to hide the fact in a way that they're dating our calendar according to the life of a man, Jesus of Nazareth, or Jesus Christ. So people don't want to say before Christ because they don't believe he's the Christ. So you can say BCE, before the Common Era, or you can say CE, the Common Era, but it's the same dating system. So you don't have to change anything, just so you know. I'm a traditionalist, so I'll use BC. And it counts down. You can see, why does it go 1755 to 1750? Because it's counting down to the birth of Jesus Christ. So in BC era, or the BCE, you count down to year 1, which is believed to be the birth of Jesus Christ, which is not, which we'll learn later when I talk about Jesus of Nazareth a bit, for Catholic bioethics. And then it counts upwards from the date, from year 1 AD, from the years that Jesus was born. Okay, so it's now 2023 years since we believe the birth of Jesus. Not really. But that's why history is so interesting. You find out, Jesus was kind of born before he was born anyways. But you'll learn about that later. So 1755 to 1750 BC is when archaeologists believe that this code that we have, and this is a picture of the code, the actual code we're talking about. It is the longest, best organized, and best preserved legal text we have from the ancient Near East. Now, where is the ancient Near East? I probably should have put a map on here, but I did not. So that's okay. We've got edge. Let's see. Type in maps, it will just take me to a map. Google Maps. Thank you. Oh, there we are. Good and Mercy. It knows where I am. Ooh, spooky. There we go. We'll go all the way across the Atlantic Ocean to this area of the world, to the country of Israel, Jordan, Lebanon, Turkey, Egypt. Okay, this is the ancient Near East. Well, actually, you can include Iraq in this as well. This whole area is the ancient Near East. So this is where Hammurabi was a ruler, and this is where the code of Hammurabi was put on this big stone pillar called a stele or a stele, and Hammurabi. I might as well tell you now. If you see here, can you see here in this here Baghdad, the city of Baghdad, okay, in the modern country of Iraq. Around this area was an ancient city called Babylon. Babylon. And Hammurabi was the ruler of Babylon, one of the rulers. He wasn't the first ruler. I think he was the sixth ruler. But anyways, there's an ancient city there called Babylon, and Hammurabi was the ruler of that. And as ruler, that's where he put up this stele of laws, so people would basically know what they could do and couldn't do. Back to this. All right. And you can see here well, do I want to talk about that now or wait? I already mentioned stele. Yeah, the primary copy of the text is on this called a stele, and I give you the definition there. It's a slab of wood or stone that's erected as a monument, and on the monument you put text. So you find them all over the world. I mean, this is not a novel idea to do these things, but you also find them all over the ancient Near East. Kings and rulers would put up stele that would describe their accomplishments, the battles they won, the people they conquered, and stuff like that. And sometimes archaeologists find them, and they found this one. It's made out of basalt, which is a finely grained volcanic rock, okay, which I guess is hard and it's good for inscribing things on. And if you look at the stele, up here you have this picture of, this is Hammurabi, and he's receiving the law code from Shamash, who is the god of the sun, also the god of justice. And then right below this, if you look, you can't see it. You can't see it, but you can kind of get a sense of it's here. That it's kind of like the surface of the basalt stele is kind of different here. But this is where all the text is. This is where all the laws were written down for people to see. Okay, so you could read this, and you knew it was coming. It was important because it was coming from a god being given to the ruler Hammurabi. The stele was discovered in 1901. In modern-day Iran, which is right next to Iraq, in case you're wondering. Back to our map here. So if you look, you can see Iraq is here, and the country of Iran is right here. So they found it in Iran. Apparently, the stele was stolen somewhere along the way, and it was taken as war booty, plunder, and was brought to Iran at some point in time. So that's where they found it. I already mentioned Hammurabi, or Hammurapi is his name. Just to give you the date when he was ruler, 1792 to 1750 BC. He was ruler of Babylon. There's a picture of him. Obviously, nobody knows what he looked like. I mean, this picture, well, if this picture was carved into the stone during his lifetime, this is not necessarily how he looked like. It's just kind of an idealized portrait, I guess, of Hammurabi receiving the law from the god Shamash. Let me write his name here so you can see it. Shamash. As I said, the sun god, but also the god of justice. Now, what is the code? let's move on. So we've got this little brief information about the code, but what is the code? And I put it here on the PowerPoint, and there are the numbers just go with each section of the laws. And once we get to section 215, we have all these laws about physicians and about doctors and how they are supposed to, well, it doesn't really tell you how they're supposed to treat their patients, but it tells you what happens basically if a doctor cures you, but also if a doctor screws up. Okay? And we don't have to read all of this. I'll summarize. But for example, if the doctor treats a gentleman with a severe wound with the bronze lancet, and a lancet is it's almost like a scalpel. It's a pointed object that you would use to open up a wound if it's diseased or if it has an infection to let the pus and the gunk flow out and stuff like that. So they already had surgical equipment, but you had to know how to use it. You could do damage with it as well as heal people. If the doctor uses the bronze lancet and cures the person, or cures an eye, I don't know why they were concerned about eyes, but maybe it was a big issue in ancient Babylon. He shall take, meaning the physician shall take 10 shekels of silver. Okay, so it's in each of these, it's telling you, for the most part, telling you what is the benefit and also what is the curse, you might say, if a physician does his job well or does not do his job well. It's case studies, basically. If the patient is able to pay 10 shekels of silver, all well and good. But if the patient is a poor person, he shall pay 5 shekels of silver. So here we see a concern for the kind of healthcare that people receive. It's obvious that some people cannot afford, even in the ancient world, could not afford the healthcare that the physicians were offering. And so now there's an ethical dilemma. What do you do about that? Do you just say, well, it's 10 shekels of silver, period. Doesn't matter whether you're rich or poor, that's what you owe me if I've cured your disease. Well, Hammurabi intervenes here in his law code and makes an ethical decision. If it's a poor man, no, you only charge 5 shekels of silver. If it's a servant, the master shall give 2 shekels of silver. Okay? Here's where we get into another kind of an ethical dilemma. All right, they had slaves, servants. Okay? Notice that, the gentleman and the poor man are apparently free persons. They're not slaves. Notice that human life is also kind of valued from a different ethical lens. Now on the good side, you still treat the slave. You just don't say, okay, the slave gets no health care because the slave's a non-person. You're my servant. So, you do sorry, you have an abscess of the eye and you can't see, it's all swollen. Sorry, serve me. There is concern even for the servant or the slave. However, notice that they pay less money for the slave. The slave is not as worthy of payment, which might raise the ethical dilemma for the physician of, maybe I don't want to treat servants. Because if I treat a gentleman, I'm getting 10 shekels of silver. But if it's a slave, I'm only getting 2. We have those same kind of ethical issues today. There are doctors or physicians who will not take Medicaid patients. Not so much because, well, I shouldn't say not so much. It is an issue of how you get paid, because Medicaid the government wants you to fill out all these forms and all sorts of things, some things that are even apparently unrelated to the health care of the patient. But the government wants the information. And if you fill it out wrong as the physician or the nurse, the healthcare professional, you fill it out even just a little bit wrong, they won't pay you. So some physicians will say, no Medicaid patients. I won't take them. So the issue of ethics or a moral issue coming from who the patient is goes back to Hammurabi. It's as old as Hammurabi. It's a problem. You might like, if you're a physician or a nurse, but especially, maybe if you're a nurse, you'll like this one, I guess. Maybe if you're a physician, you won't like this one. But number 218, the law, if the doctor has treated a gentleman with a severe wound and has caused the gentleman to die, or has treated an abscess of the eye, okay, of a gentleman, and the eye is lost, the eye is destroyed because of the work of the doctor, you cut off the hands of the doctor. So I guess that ends his career. That's the end of that one. As I told you before, being a physician in the ancient world could be dangerous if things didn't go well.
Did it happen like every time then?
What?
Like in the beginning, like did everyone's just hands get cut off?
Well, I don't know. I wasn't
I feel
there.
like that's what would happen.
Well, you have to, ancient law codes, you have to take them with a grain of salt. Because a lot of times I think they're giving what's the ideal situation of what should happen. And maybe that's not what always occurs.
Yeah.
But it should occur.
Yeah, because I feel like all of them probably made a mistake at least one time.
Yeah. Well, think of it today. I mean, well, maybe not so much today, but in decades past, physicians could be seen like gods. They could never make a mistake. They simply couldn't. And even today, I think, mistakes happen. And people, sometimes it can be harmful. And what is the doctor? What do you do with the doctor? Do you blame the doctor? Do you fire the doctor? Cut off her hands?
I'd say no to that one.
Say no? Well, but if someone loses an eye, Mr. Kazin, they're not going to get that eye back.
They will not. So yeah, I guess cut off their hands.
Or take their eye.
Yeah, I know.
Take them out back and say, give me that eye! Like that lady in, Kill Bill. She cracked, maybe you haven't seen it. She rips people's eyes out as a special kung fu move. Again, I'm not going to read all this. I put this on the PowerPoint. You can look at it yourself, but it deals with treating severe wounds, deals with treating number 221 if the doctor has cured the shattered limb. Okay, so broken bones. These are kind of like the stock and trade of physicians, at least of the time, dealing with infections and dealing with broken bones. And how much money that they should give. Again, you see this distinction between a gentleman, a poor man, and a servant. But I thought 224 and 225 are interesting because it seems to be, from my perspective, the earliest quasi or semi-ethical principles we have for veterinarians, for animal science, for taking care of animals. If a cow doctor or a sheep doctor has treated a cow or a sheep for a wound and cured it, then you give 1/6 of a shekel of silver to the doctor. But if the cow or sheep dies, and I'm presuming it's not just cows and sheep, but if you treat other animals as well, but these might be the main animals that they were dealing with if they were pastoral culture, people, shepherds and stuff like that. So these were the animals they had. If you cause it to die, then you give the quarter of the price to the owner of the ox or sheep. So notice that the ethical perception is different here. If it's a human being who loses his life or her life or loses an eye or something, then you cut off the hands of the doctor, of the physician. But if the physician can't save your cow, well, then you just pay a certain amount of the price for the animal. So there's a distinction here between human life and animal life. This form of medical ethics or bioethics is called casuistry. Okay? You're dealing with cases. Each of the laws is dealing with a specific case. If, the doctor, the physician deals with this sort of medical case, then this should happen. All right? Then in the case you pay a certain amount of money, or you cut off the hands, or you do something. This is casuistry. If this is the circumstance, then this should happen. Okay? It's a process for deciding the ethical course of action based on the circumstances or conditions. comes from the Latin word casus, which means to fall down, but it also means occasion, can be used to mean an occasion or an opportunity for something. And that's kind of like what casuistry is dealing with, occasions of action. So the scope of the Code of Hammurabi is broad. It's casuistic, and it doesn't just deal with medical issues, but it deals with criminal law, family law, property law, commercial law. And mostly, as I told you, the concerns of the code are how much the physician is to be compensated for practice or punished for failure. A different form of bioethics, or you could say medical ethics, is found in the Hippocratic Oath. And medical ethics really is the oldest subdiscipline of bioethics. The Hippocratic Oath dates from the 500s to the 300s BC. Sometimes you'll see that it's dated to the 500s BC. Okay, but I mean that's based on supposition. That's based on kind of like a best guess situation. It could be as late as the 500s, in which case it would be during the time of this man Hippocrates. But it could be as early as the 300s BC. Our earliest reference, or I should say evidence of the Hippocratic Oath is this fragment of papyrus. Papyrus is ancient paper, and here you have a fragment with a portion of the oath written on it, called the Oxyrhynchus Papyrus 2547. And I don't remember what date it was found. I think it was found in the 250s AD. I'm going to say 257, right? 257 AD. So that's if you're looking for our earliest, I'll write it down here, 257 AD is the date of this papyrus that I have on the PowerPoint. And that's our earliest physical evidence that we have for the existence of the Hippocratic Oath. But scholars accept that it probably does go back to the time of this man Hippocrates in the 500s BC. And the Hippocratic Oath marks the beginning. Not that people weren't thinking about it before, but kind of our hard evidence for the beginning of Western ethical reasoning and decision-making in medicine. And you see here, whoops. What is this? Okay. See here the definition of the Hippocratic Oath, an ancient brief statement of ethics for practitioners of Western medicine believed to have originated with Hippocrates of Kos. We don't know what Hippocrates looked like. I mean, there are no pictures of him and no busts or statues. So this picture is just something I got off the internet. You know, I don't know why he has to be bald or have a beard, but I guess that's whatever floats your boat. Hippocrates of Kos, notice in the definition, I put it with a C, and here I put it with a K. You'll find it spelled both ways, so it's not a misspelling. You'll find it spelled both ways, Kos. And I'm just kind of referencing that or honoring that difference. Hippocrates, you can see when we believe he lived from around 460 BC until 370 BC. And he's a semi-legendary figure. He's a semi-legendary Greek physician. By semi-legendary, we mean that we think he existed, but, most of our evidence for the existence of this man Hippocrates comes after the fact. We don't probably have any writings from him, but we do have a lot of writings about him. So people seem to have known him. So, the general consensus is that he did exist, but he's called semi-legendary. Probably a contemporary of the great philosopher Socrates. And you can see his dates there from when Socrates lived. So, I don't know if he knew Socrates, but hey, here's another phase like, Matthew Dunn lived during the time of Taylor Swift. I've never met the woman. I don't know the woman, but okay. it places me in a historical context. The same thing here. This great philosopher Socrates lived during the same time. And Hippocrates is the most famous physician of antiquity, of the ancient world, but is also the least known. Okay, he is, according to look at my notes here, that's 34. I think it's the Oxford Dictionary of the Classical World. He is, quote, a name without a work. We have a name, probably don't have any writings by him, but we do have writings that are attributed to him. Writings dealing with medicine, by the way. All right. We're getting to the end, so I'll stop here and talk more about Hippocrates on Thursday. Good to see you all. Have a good day.
Looks like yeah, no, they take
Okay, I'll turn you off, my friend. God bless anyone who's watching.